Good morning, welcome to this accountability and performance meeting, our sixth meeting since my election for the benefit of members of the public. Watching, you're very welcome. I'm Jonathan Shepherds, Police and Crime Commissioner for Hertfordshire. I'm joined by Charlie Hall, Chief Constable of Hertfordshire Constabulary. These meetings are designed to help me fulfil my statutory duty to hold the Chief Constable to account for the delivery of policing in Hertfordshire, and we've sought to do it in a transparent way that's visible to the public. The public side of the meeting is in view-only mode, so there isn't an ability for the public to ask questions, but hopefully the conversation that the Chief Constable and I will have is interesting and useful. These meetings are designed to be strategic in nature, so they don't cover any individual cases where there are established mechanisms for any concerns to be raised. We've got three items on today's agenda, which we'll cover in this order. The first is a national report done by His Majesty's Inspectorate of Constabulary relating to the policing response to antisocial behaviour, then responding to people in mental health crisis, and then rural crime. That'll be our agenda in that order today. So we'll start then with the Peel Spotlight report from HMIC FRS on the policing response to antisocial behaviour. As I said, this is a national report that the Inspectorate have produced. It's not specific to Hertfordshire at all, but it reflects on a range of themes that the Inspectorate have identified from all of the reports and work that they do looking at police forces nationally, and there's a number of recommendations for police forces, many of which are sort of into next year, so not expecting them all to have been implemented now, but I wanted to discuss with the Chief Constable some of the issues that the Inspectorate identified in that report. Perhaps I could just start off just by asking how the Constabulary is reflecting on the findings and recommendations of the report in totality.
Okay, thanks, Commissioner. So we have received a report, as you say. It was published in October of this year. My teams are now working through that. It's a helpful commentary. It's been put together, as you say, by visiting forces, a number of forces nationally. Hertfordshire was not one of those, but that's not to say some of the things within this we need to look at, including working through the recommendations and now developing plans against those to ensure that we can respond where they are. It identifies some good practice across forces, and we would certainly recognise some of that in terms of the problem-solving work, the focus with enabling teams, links into partner organisations, some of the early preventative interventions that are put into place. There's some other recommendations around ensuring that we are recording incidents correctly, members of the public can report things, and that we identify them as antisocial behaviour incidents, some further work around analysis of those to pick up patterns that are being reported into us, and doing more and ensuring that all officers and staff who are involved in the response to that have been trained. And there's an ever-increasing range of powers and policies and things that can be applied within there, so we need to keep that refreshed. So the team's now working through that. In particular, it's being led by the Chief Superintendent, heads up the local policing command, John Simpson, as it's largely his teams that are delivering these interventions. And as we develop that plan, work that through, as you say, most of the dates are into next year for delivery against this, then we'll clearly report them back to you where they are with that. So, but it's certainly been well received, and I think it links well with the focus that we've got on neighbourhood policing, and as we know, that's going to be a growing focus over the next year or so as the government wants to invest in neighbourhood policing through their neighbourhood policing guarantee, and I think this is very firmly in the middle of that.
Thank you, that's useful, and I think certainly reflects, as you say, the work being done in Hertfordshire, particularly around some of that prevention, problem solving, some of the work on antisocial behaviour hotspots as well. And yeah, I think antisocial behaviour can be a really significant issue for communities, and but also sometimes not the easiest issue for policing to respond to, and requires a lot of partnership working as well. I wanted to just ask about the sort of theme that the Inspectorate identified around recording vulnerability in antisocial behaviour. Could you just share a bit more around how the Constabulary assesses vulnerability and repeat victimisation as part of antisocial behaviour cases?
Yeah, and I'm sure members of the public will recognise that sometimes antisocial behaviour is particularly targeted towards vulnerable people. So it is important that we recognise if people are vulnerable and understand the impact that such behaviour can have on those individuals, and often that will be repeated. So we have a number of mechanisms to do that. Primarily it would be at the first port of reporting, which frequently is through the control room. And this is important not only across antisocial behaviour but also other incident reports and crime reports that come in. So we've got some clear procedures in the room that asks our call takers to check our existing systems as to whether there's previous history involving these that might identify repeat incidents or vulnerability. There's some particular question sets that we ask the call takers to run through with the individuals themselves reporting that are designed to identify vulnerability, and through all of that we then undertake some risk assessment against the calls that we have coming in, and both what we are being told at the time by the person reporting, but also what we also know within our systems. There is more work that still needs to be done to make that analytical work within the systems easier, and to ensure that it's pulling out everything we absolutely need it to. And then importantly, when it lands with teams to investigate these offences and follow up, there is a clear expectation from them that they continue to assess that vulnerability of those callers, and that will include at times working with other organisations, be that housing providers, local authorities, and we operate a system to manage our response to antisocial behaviour that is an IT system that is shared with many of those partners, so we're able to make our data visible to relevant partners, and equally can see the actions that they are taking in relation to some of these cases.
That's useful, and I can see from just some of the data that the analysts in my office have shared that actually that checking and sort of system tagging around vulnerability and repeat victimisation is very high and very strong, and actually has improved over the course of this year. So that's very positive to see. We also talked in the last meeting around the work that's being done on crime data integrity and improving crime recording. How is the auditing and quality assurance process that sits as part of that working to ensure that antisocial behaviour is being correctly recorded?
Yeah, so these are all linked together, and it's broadly the same teams that are working on this, and that's in part because some of the incidents that are reported as antisocial behaviour involve criminal behaviour and crimes that we need to record within that as well. Not everything that is antisocial behaviour will necessarily be a crime and lead to a recorded crime, and some of those will be recorded as incidents of antisocial behaviour themselves. So the work that we have been doing is ensuring that audit process and that quality assurance process is strong, and that they are looking at all of these incidents coming in and ensuring that we have recorded those correctly. And that is going to help us moving forwards with the analytical work, so that we understand the true nature of everything that's being recorded and reported into this. And it's interesting that as we look at some of the data over the last 6 months as this work has progressed through, it has shown something of a reduction in our recording of antisocial behaviour incidents, and we think that's largely because we are picking up that some of these should properly have been recorded as crimes, and we're recording them as crimes such as criminal damage offences or harassment offences that maybe previously were not being recorded as such and were being dealt with as antisocial behaviour incidents. So that gives me some confidence that the process is starting to work through.
Yeah, okay, that's useful to hear. And you touched on that partnership work, which is important both in terms of some of that risk assessment and management of antisocial behaviour cases, and actually the HMRC inspection for Hertfordshire highlighted that the Constabulary is making effective use of those case reviews. Are you satisfied in terms of the sort of escalation process that sits with them? Because obviously there are various opportunities for members of the public to seek further reviews. Are you happy that that is working effectively in Hertfordshire across partners?
Well, the process is there. I think the partnership working is pretty strong in most areas across the county. The day-to-day partnership working predominantly rests with the neighbourhood policing teams across the county. They will be well connected in with local authorities, housing providers, youth services, and other local groups, and very much aligns with the prevention first approach as well. Very often the resolutions and the ways through some of the often quite intractable incidents that are being reported to us is a partnership approach, and it involves intervention from a number of different agencies, and often no one has that. And there are systems to allow people to question and raise issues and ask for review of the approach that's been taking place if these move forwards. But I'm really confident that there's a lot of work that takes place around this, and we ask our teams to put in place problem-solving plans, and very much those problem-solving plans need to involve partners. And as I say, we've got the IT systems that enable us to share, so that individual different organisations can update against those plans as to the action that's being taken and governed there. And I think we've got a number of examples where that's worked well.
Yeah. And then particularly on that point around problem-solving plans, his recommendation 4 in the report, which is the one actually for the end of this month rather than the ones that largely sit into sort of next year or by 2026 even, is around those problem-solving plans and asking forces to satisfy themselves that they are specific, detailed, supervised and well evaluated in line with the national NPCC guidance. What scrutiny has the Constabulary done to ensure that that is consistent across neighbourhood policing teams?
So we do, I say we have a system to be able to manage the plans. The teams themselves know what's expected within there. The supervisors have particular roles to ensure those plans are being fit for purpose. They are expected to continually review them, revise them, properly supervise them. And then in addition to that, at a force level basis, we do some dip sampling into those to check that the plans are where they need to be, and we then put actions on the back of that. Are we completely in the right place with all of them? Not always. There's always some room for improvement. I think there's some further training we will need to put in place with some of our teams to support with that. But we've got those monitoring mechanisms in place, and my sense is that they are improving as we move forward, and that focus will absolutely continue, because good, strong delivery of these plans is what's going to make a difference for local communities.
And Hertfordshire is one of a small number of forces piloting the neighbourhood policing pathway training that's then going to be rolled out nationally, which is really positive. Do you anticipate that and improving the kind of specialism and support for neighbourhood officers is going to be part of the solution?
Undoubtedly, because that will focus on good, strong partnership working, engaging with communities, understanding the problems, and then doing that problem solving, what good problem solving looks like. And very definitely a part of that is good, strong recording of the actions that are being taken. So, I mean, broadly, I think we're in a pretty reasonable place already on this, but of course we want to improve it.
Excellent. And then I just wanted to pick up on the use of statutory powers, because again we've touched on various statutory powers and orders sort of across some of these meetings, and inevitably there's a lot that link to antisocial behaviour. It'd be useful to know, to get a bit of a feel around how you feel they're used across the Constabulary. The sort of origin for my question is that it was interesting seeing some of the data around the use of ASB powers for for Operation Hotspot, there's really considerable variation in the use of those powers between the hotspots, and some of that will just reflect the nature of the hotspot. But it'd be useful to just understand how those powers are being used and kind of what the variations might be between CSPs.
So you're right, we've got many powers that police can use in terms of intervening and problem solving, both around criminal offences, antisocial behaviour incidents and the like, and we maintain a database to try and track the use of those powers, and I've got a list here, there's around about 30 different things that we're tracking within this, from things like civil injunctions, closure orders, dog banning orders, protection from harassment, domestic violence protection orders, and not all of these will necessarily be relevant for antisocial behaviour use, but some of them most definitely are. And in total, since the beginning of April, our database is saying that we've used those powers on 663 different occasions spread across those. Among the most common ones that we use is something called a community protection warning. We've used on 290 occasions, and the higher level of that is a community protection notice, which is on 70 occasions. So the warnings would generally be used to ask people to desist or not to behave in certain ways, and as a warning, and often that is sufficient in its own right that we formalise a warning and say, if you continue in this way, we will move on to more formal action, and the community protection notice will often be that more formalised action if the warnings aren't heeded in that way. Many of those we know will be being used extensively by neighbourhood teams in the problem solving work around antisocial behaviour activity, and indeed some of the other orders at times will be relevant to address that as well. And I think what is important is the training that we've already talked about, including the pilot work that we're doing with the College of Policing, will have a strong theme around the available orders and how to use them. And I think we do need to help our staff and officers understand the differences, the legal differences between the different protective orders and powers that are available to put in place, and which ones are suitable on that occasion. And often they are necessary, because we do need a more stringent set of requirements to put on individuals to curb the behaviour that they're otherwise displaying.
Yeah. Thank you. And that certainly that data around the community protection warnings and then notices would suggest actually, in many cases, actually those warnings are quite effective. If sort of 70 out of the 290 escalate to a notice, but 220 don't, actually I think that's quite a positive position in terms of that kind of first intervention having some impact on people. That's useful. Thank you. I'm going to move on then to our second agenda item, which is responding to people in mental health crisis, which is an issue that comes up periodically in terms of the pressure it puts on police officers, but also the importance of ensuring that people in mental health crisis in a moment of real vulnerability actually get the right response from the right service, which very often is health, not police. I know there's a lot of work being done nationally, and indeed Herts has been part of that around the Right Care, Right Person programme that is around shifting where some of that response sits, and I know there are some challenges in that around the NHS's capacity as much as anything else. Can you just understand where we are with it? So firstly, how is the Constabulary addressing calls about people in mental health crisis, and how are police officers supported to respond to those calls?
Certainly, I think to start to say this is a real issue for us. It is a significant driver of demand on policing services, and in recent years it seems to have increased, which is in some part why the right care, right person response has been put in place. So, data I've got here for in the last 12 months in our control room, we have recorded just over 17,000 incidents that we have classified as involving mental health, which is behind the purpose that we have been called. And that will be a whole wide range of reasons that people have felt the need to call us about. And within those, almost exactly 50% we have felt the need to provide a policing response to. And that is a really significant demand for us. So that's around about 24, 25 per day that officers will be sent to from the control room to respond to. Some of those incidents they'll be able to deal with relatively swiftly. The work that we've been doing with Right Care, Right Person is that it's my belief and our belief that we are still being called too frequently, and we're being called about incidents that really are not for police to respond to, and probably more correctly lie with other organisations, agencies to support with. But we know that policing is often the last resort port of call, and we are quite an accessible organisation, being here 24/7 and have a local footprint all across the county and indeed the country, of course. So we have been focusing on trying to divert those calls elsewhere where it's appropriate to get them to the right organisation. And where we do receive the calls, we've been assessing very carefully as to whether it's right that police attend those at all, or we put them off to another organisation or agency. So we have seen the number that we respond to, of the percentage of the calls coming in, start to reduce, and that's been a key line of work for us around the concern for welfare calls. So we've been operating that since April, and at present we feel that we've been able to reduce the amount of time that we're having to spend on those calls by about 2,500 officer hours since April. That I think still needs to come down further. We think we are still over deploying is the word I would use in about maybe up to 30% of those cases. So we still think we should be deployed to fewer of the calls than we currently are, but clearly we do need to call some of them. So there's a lot of work within our control room about asking the right questions in the first place to determine the level of risk that's being presented and which agency should take responsibility for that. And we are working very closely with our health partners in particular around this, and we've set up a scrutiny panel now that involves our partner organisations to go through these calls and ensure that we have our policy right in terms of how we respond. So we are checking that as well, because I do recognise we don't want to be in a position where there are things that we absolutely should respond to that we haven't responded to, and leaves the public vulnerable. But if we respond to all of them, that's hugely problematic as well, because it will probably mean the higher risk ones that we absolutely should be responding to, maybe we're not getting to as quickly as we should, because we're having to service that whole demand.
Yeah, okay, that's useful, and really stark figures there actually, 24 to 25 incidents a day. Officers being asked to respond to and attend, and actually when we then talk about response to antisocial behaviour or crime, actually that has a real impact in terms of the time that officers have got to deal with those other things that only policing can do.
And because there's some crossover as well, because some of the antisocial behaviour incidents we are dealing with have mental health are lying behind them as well.
Yeah. In terms of that point then around perhaps still slightly over deploying, you talked about work being done in the control room to look at that. What are the next steps, and kind of where do you see what's the timescale do you think until the Constabulary will be getting to the kind of the right balance on that?
Difficult to say. I think this is going to be work that we continue with, and there's other strands around the right care and right person approach that we are looking at as well. So would include trying to do some problem solving, some partnership working with some of the big drivers of some of that demand. So one of the things that we've been doing is working very closely with the hospitals in the county about the approach for vulnerable people who have gone missing from the hospital or walked out from the hospital. Our view is that we would expect the hospitals to do much of the initial work about trying to find that person before needing to involve us at that point. Clearly we recognise some of those people will be vulnerable, but there are some checks and measures that hospitals and things should be undertaking to help us with that, and that work is working through. And I think one thing I am really pleased about is we've got really good, strong engagement from the health sector on this, but I also recognise the solutions on their side are not necessarily always easy to deliver, and are dependent often on funding and resourcing as well. And I think we all understand the NHS is under huge pressure in much the same way the police are.
No, exactly, and there's clearly been some progress made around reducing officer hours spent in hospitals, in emergency departments. I can certainly see from data that there was a bit of a sort of peak in May, but has come significantly down over the subsequent months. In terms of the wider kind of right care, right person implementation in the county, where would you assess that is at the moment?
So I think the biggest challenge from the policing side still remains the dealing with individuals that we use Section 136 powers on. So just to explain, they're powers under the Mental Health Act that enable police officers to intervene with people who are clearly in or appear to be in some mental health crisis and need some support and assessment for their mental health condition, and it enables us to detain those individuals, take them to a place of safety where they can undergo some specialist assessment, and a decision can then be made by the health practitioners and mental health professionals as to whether those individuals should then be detained in hospital for the purposes of treatment for their mental health condition. The challenge we have with that is that when we use those powers in a public place, we then are required to take those individuals to a place of safety for the assessment to take place. That in this county is generally either, and the preference is to be able to take them directly to the mental health facility, which is one facility that we can use in the county to do that, or failing that, they get taken to emergency departments in the hospitals, and they would go there either because there's no capacity in the specialist facility to take them and undertake the assessment at that time, or there's some other medical cause. Sometimes these individuals have sustained injuries as well, which would mean that they need to go to emergency department. And what our experience is that around about 80% of the cases we take to emergency departments. About half of the time that's because there's other medical issues. The other half of the time is because the specialist facility has not got the bed capacity to take the individuals. And in particular, because of the pressure on the emergency departments, the officers can spend a long period of time sat with those individuals at the emergency departments waiting to be seen. And if I look at the data, I think for last month, we undertook 53 of those Section 136 detentions across the county. 42 of those were taken to emergency departments. And the average wait time that officers had with each of those patients was just shy of 16 hours, which is a really considerable period of time. We have been engaging really significantly with the health sector on this. I absolutely recognise it presents challenges for them because we all know emergency departments are very busy. They do not necessarily have the bed space to be able to accept these individuals easily, and they also do not often have the resourcing to be able to relieve police officers and take them from us. So we are continuing those discussions. Of course, I would like to see more progress on this. There is some things that are being put in place to help that. So the Lister Hospital has recently put in place some resourcing that will be able to take some of these individuals off us more quickly. That's fairly recently been put in place. It's not covering the 24/7 period yet, but it is covering the busier periods, and I'm hopeful that as we start to track the data, we'll see some improvement in that. But in terms of the overall right care, right person place, that's the piece that I personally feel is still going to need more work going forwards. But I think I'd stress we have good relationships with the health sector. We understand some of their pressures, and we continue to work with them to try and see inroads to this, because I want these police officers released. And frankly, sitting next to a police officer in an emergency department is not probably the best solution for people who are in mental health crisis and probably need medical treatment and intervention.
Absolutely, and those are really significant figures in terms of that weight for a police officer. I mean, to put that in context, that's not just kind of the rest of that officer's shift. That's the next officer's shift as well being taken up with that. So clearly there's been some progress, but clearly, as you say, quite a lot of work still to do there in partnership as well. That's useful. Thank you. I'm going to move on to rural crime. Which I attended a couple of meetings with the NFU and members of the public interested in this area a few weeks ago, particularly farmers in the sort of north and east of the county and a bit in the west of the county as well, where quite a lot of issues were discussed around rural crime that do cause concern for some of our rural communities. So I wanted to just have a look at some of those rural crime issues, and particularly talking about things such as theft of farm machinery, wildlife crimes, fly tipping, all of those sorts of things that can be particularly problematic for rural communities. Perhaps I could start by asking how the Constabulary is improving its understanding of rural crime in Hertfordshire, because rural crime isn't kind of a specific Home Office category for counting data, so it requires a bit of a sort of local understanding.
Yeah, you're right. It's difficult to classify rural crime because there is no standard definition, and it's not just crime that takes place in a rural location, of course, because that would include domestic disputes, for example, that are in rural parts of the county. So it does present us with a problem as to how we pull that out. I think most people, and certainly the farming community, would point towards the types of incidents that you've just described that are happening within on their farmland and other places. So we do work with, we have a rural operational support team, the ROST team, that particularly focuses on rural crime issues and supporting communities all across the county with this. They engage very strongly with local neighbourhood teams, and some of our neighbourhood teams in particular cover rural locations. So East Hertfordshire would be a good example of that, where much of that is rural, so that we can understand the crimes that are being suffered within the rural community. And we recognise some of these are hugely impactful on farms and landowners. If tractors are being stolen or broken into or parts taken from them, that can immediately make those vehicles put them out of action and mean that they can't be deployed into their fields and things. And we also recognise that many of those victims feel particularly isolated out there. They're quite often not overlooked by neighbours, and they naturally feel vulnerable as a result. So, we will work with them around some of the preventative measures that can be put in place, lighting, CCTV measures. We do target patrol activity in those locations as well, and we do meet on a very regular basis with them so that we can hear those incidents and coming through. The classifications we do make, I have got some data from the start of April as to what we consider maybe a rural crime in the area that you described. My estimate is that's an under-recording because of the difficulty of recording that, but that would suggest that we've recorded perhaps around about 300 of those crimes. I think that will be a considerable underestimate as to the amount of crime that has actually taken place, if I'm honest, which is why we encourage all the teams to engage on a really regular basis with the community and speak to them. And we have, for a number of years now, run a number of what we call barn meets, where we work with a farmer in a rural location. They open up one of their barns and we invite the community from around the area to come and speak directly to us so that we can hear the issues, describe what we're doing and help to shape our response accordingly. And they're usually this sort of time of year, so I suspect we'll be looking to engage the community again shortly on exactly these issues.
Thank you. I think I said one in my diary for somewhere in the new year. I'm looking forward to that. There's, as I understand it, there is so there isn't a kind of Home Office classification, but my understanding is there is within the crime reporting system a sort of rural tagging option. And from the data my office has produced, that kind of looks like it's reduced quite a bit over the last 3 years or so, which, as you say, is probably not because there's less crime, because it's not being sort of categorised and recorded in that way. Is the work being done to look at how, in the control room, that sort of tagging of rural crime is being used, or is that not the focus at the moment, given the sort of Home Office?
Well, we do, and one of the things we have done is train our call handlers about the impact of rural crime. Why, when a farmer calls up, for example, and says they've got hare courses on their land, why that is an issue and the expected response. And some people, perhaps who've been brought up in rural communities or farms, might instinctively understand that. I think a lot of people wouldn't necessarily understand why some of those things are issues for them. You're right, we do operate a tagging system for incidents, and we do rely on that to try and pull out some of the data. It is not perfect, which is one of the reasons why I think the data I've quoted to you is an underestimate, because we use those tagging systems for a whole variety of different incidents that are reported to us as well, and it does very much rely on people being able to pick out those particular themes and ensure that they apply the tags, and it's something that we remind people very much of. I think ultimately going forwards we probably will look to some more advanced IT solutions, maybe some AI solutions that help identify that from some of the words that people are saying to us and ensure that those tags are automatically applied. But we're not there at this point, which is why I think we ask our call takers to do a huge amount. The assessments, as I've already talked around vulnerability. Are they repeat victims? Often they're having to deal with callers who are either angry or emotional or upset, and that's a lot of work. And then alongside that, we're also asking them to recognise that they need to apply different tags. Which is why I think we need to look more strongly at some of the technology that can help them deal with the myriad of tasks that we ask.
Thank you. There's a lot potential there. I would agree. One of the concerns that kind of inevitably, given the geography that you hear from rural communities, is around response times and a theme that response times are longer because they're further away from a police station, or just the sheer geography of getting to an incident compared to if you were in one of the kind of urban towns. So there's probably not loads that can be done to improve that, but how does the Constabulary monitor the response times to more rural or isolated parts of the county where there are incidents?
Yeah, so we do, for our most urgent instance, our immediate instance, which is where officers would be expected to respond on blue lights and sirens, we set a response time of 15 minutes is the expected time that we would look to respond to the point at which we first answer the call in the control room to be able to get officers onto scene within 15 minutes. And that's a universal standard whether you are in an urban part of the county or a rural part of the county. Some police forces split that out and they say 15 minutes if you're in an urban area and maybe 20 minutes if you're in a rural location. We have chosen not to do that because we feel that wherever you are in the county you should have an expectation that we will look to attend within the same period. That said, it can be more challenging in the rural location to reach that aspiration, but we absolutely target to do that. Across the county as a whole, we're achieving that target response time in just over 80% of the cases. We tend to do that. I'd like to improve that further, to be honest. We do operate systems within very clear mapping systems, so the operators on the radio who are dispatching teams will be able to see exactly where the incident is on the mapping system, and the mapping system will show them where all our resources are, because they're all geolocated, so they can use that technology to help select the appropriate resource, the closest resource to be able to deploy. And we've also got a clear system that operates there for the for the dispatchers to be able to bring those incidents up so that they can clearly pick them out, see those that look like they're getting to the point where they're going to miss those targets, so they can reprioritise as well. And again, our supervisors in the control room are constantly looking at all of these to ensure that we are getting the response in place appropriately. And we'll continue. That is a key day-to-day focus on ensuring that our response times are where they need to be, and we can continue to track them and monitor them. And indeed, they get fed all into daily meetings, operational meetings that are run, where our ability to respond is constantly looked at, and where we can to look to improve that further.
Thank you. And in terms of the analysis that then goes into that 80% hitting that 15-minute target, is there any sense in which the ones that aren't being achieved are then disproportionately rural areas just because of the challenges of...
It is more challenging. It will be more challenging in the rural areas. We break all of that data down against time of day, and we break it down to our district council areas, so we can see that some are able to achieve that. It's probably no great surprise that places like Stevenage and Watford that are pretty contained and almost predominantly urban, the response times tend to be slightly better because geographically they are tighter and smaller, albeit I would say that they tend to have higher volumes of incidents as well that need responding to, which balances it to some degree. Often in the rural areas we don't have many calls that need these immediate responses, but when they do come in, obviously we recognise we need to get there quickly.
And then one of the things that's really apparent with some rural crime is the extent to which it is very cross-border, sometimes driven by organised crime, organised fly tipping, for example. How does the Constabulary work, not just with other police forces across borders, but also with other agencies? Obviously, the Environment Agency has a role to play in some of that to detect and prevent that more organised crime.
Well, it'll be no surprise that some of the issues that we face in the rural community are very similar to those that neighbouring counties and other police force areas are experiencing as well. So there's a lot of commonality in that, and of course the East east of England in particular is a pretty rural area, lots of farming communities out there. So we do work closely with our other police forces on cross-border operations, and we work with the likes of the Environment Agency, the Vehicle Standards Agency, local authorities, in terms of the powers that they can bring to things like fly tipping or hair coursing and the like. Our Ross team that I described is in the middle of that for us, and engaging with counterparts in other forces and into those agencies, and we've got a number of examples of work that we've done. So we're working currently on Operation Phoenix, which is an Environment Agency-led operation, which is about large-scale fly tipping of industrial waste largely, which is predominantly the Environment Agency's responsibility, but obviously they need policing to help track vehicles, track locations, and with the enforcement work. So that's operating across a number of different counties. We regularly run an operation involving forces that border Hertfordshire, and often that involves Bedfordshire, Cambridgeshire, the Metropolitan Police, Thames Valley Police, Essex, where we work with road policing units and really to track criminals who are working across our borders and targeting into rural locations. We use ANPR extensively through that work, and usually when we run that, we end up with a significant volume of arrests across those forces, and that is really good around the intelligence sharing, so that's good. And we've also run hair coursing operations across county boundaries as well, working effectively with other forces, particularly Cambridgeshire, Essex, Suffolk spring to mind as forces that we've worked very effectively with around targeting hair coursing, and we've seen reductions in that in previous years as well. And I'm absolutely confident that work will continue in the years to come.
Lovely, thank you very much. So that brings us to the end of our formal agenda. But of course, this is the last of these meetings for you before your retirement, Chief Constable, and I want to just publicly say a huge thank you to you for your service to policing over your career, 32 years in policing, 8 years as Hertfordshire's Chief Constable. Really considerable and distinguished public service, and I know there's been a lot said within the Constabulary and also at events to recognise that, and I just want to do so publicly as well, and to thank you very much for all the work you've done in Hertfordshire to make the county the safe county that it is today, and for your service, and wish you all the very best for the future.